everyone, welcome to Patient Knowledge. I'm Dr. Vazala Kirmani and back with another video. Today I'm going to be talking about benign prostatic hyperplasia. So let's get started. Let's begin with the explanation of the term. Benign means cells aren't malignant and they don't invade the neighboring tissues. Prostatic stands for prostate gland and hyperplasia is an increase in the number of cells. It's a non-cancerous growth of the prostate gland and is common in men over 50. It's often considered a normal part of aging. Let's see how common is the problem. It's common in men over 45, rarely cause trouble in less than 50. By 55 years of age, 50% will have waterwork trouble. It increases to 80% of men over 80. Serious trouble affects 2 in 10 elderly men. Let's look at the symptoms. People with prostate enlargement may experience frequency of urination. They may have an urgency to urinate without much warning. They may wake up at night with this urge. They may have difficulty starting and sluggish stream, especially first thing in the morning. They may have a tendency to dribble after urinating with wetting of pants. They may need to urinate a second time after only 20 minutes. And pain is a rare problem. Let's look at the prostate gland. It's a brownish gland about the size of a walnut that surrounds the opening of the bladder and about the first 2.5 centimeters of the urethra. Now, the urethra is a tube passing from the bladder to the private part. Now, this gland produces substances that make up a small part of the semen. Let's throw some light on the effects of BPH. It's a non-life-threatening condition, but it impacts the quality of life. It's embarrassing. It's uncomfortable and inconvenient. As the gland grows, it can squeeze the urethra and more serious problems can arise, such as infection of urine, sudden blockage of urine, or slow blockage of urine, in which case urine is to be removed by passing a catheter. Now, what will your doctor do? Your doctor will assess your condition and check on your medication. He will perform a DRE, which is a digital rectal examination. Now you must be wondering, what is DRE? It's a simple test where the doctor passes their finger through the back passage to assess the growth of the gland, whether it's mild, moderate, or severe. This will help the doctor to make a management plan. They will also run a urine test to exclude urinary tract infection and then refer you to the urologist, who's a specialist in this field. The urologist will run a blood test called PSA, is prostate specific antigen, and another test called urodynamic studies, which measures the flow of urine through the bladder. Now this will check the condition of the bladder. Let's look at the treatment. It depends upon the severity of symptoms. If there are only mild symptoms, you are usually taught to learn to live with it by making some small lifestyle changes, such as avoid alcohol after evening meal, avoid fluids 3 hours before retiring, get up immediately when you wake up with the urge to go. Do not hang on, visit the toilet when you need to, and empty the bladder completely. Just wait for a while. Medication. This is the first line of treatment and is given to people whose symptoms get worse. A combination of therapy is used, which will have effect on the prostate and also on the bladder. The drugs are used to shrink the prostate and relax the prostate, and the other type of drugs they relax the bladder. Now it's effective for large prostates and has a better long-term effect. It also lowers the risk of complications. However, Surgery is required eventually for most prostate problems. The surgery is called prostatectomy, and almost 1 in 10 men will need it. That's all about benign prostate hyperplasia. Thank you for listening. I hope you got some idea about prostate enlargement. If you like my video, don't forget to like and subscribe to my channel. If you're interested to know about any medical condition, leave it in the comment box below. Bye for now.